This is Mom Squad Pod, your weekly update on tips, tricks, and all things parenting with Maureen Kyle.
Hi, everyone. Thanks for joining us on the Mom Squad, the podcast and the show where we talk all things parenting. I'm Maureen Kyle, and with back to school around the corner and wellness checks for your child, you might be faced with the question, do you want to vaccinate your toddler? Families have a lot of questions about the reactions your young child might have with the vaccine, how effective it is in little ones, and a big question, what do we do if we just had COVID? Do we need to get a vaccine right away, or do we have natural protection? I got a chance to talk to Dr. Amy Edwards, an infectious disease specialist with University Hospitals Rainbow Babies. She's part of the American Academy of Pediatrics, and here's what she had to say.
Now that the younger age kids are able to get the vaccine, what kind of response are you seeing from parents and from families?
Most of the families in my circle are very eager to vaccinate. I've gotten tons of emails from colleagues and friends. Hey, where are you getting your kid vaccinated? What's the easiest way for us to do it? I don't know how much of that is that I'm just friends with a lot of doctors. And so we tend to be the ones who are, being in the front lines of COVID, we understand what this virus can do. And so we're the ones that are most likely to vaccinate our kids. Also, a lot of my friends have heard me go over the science. And so I think, I have a very high rate of vaccine acceptance in my group. I know that there are vaccine hesitant parents out there. And that's, that is what it is, but I'm just thrilled that the vaccine is available for those who want to get their kid protected.
Yeah. And I mean, I don't know if it's factored in that, the older age groups were able to get the vaccine. And then parents were able to see how kids were reacting to it and how it worked. And so I guess that's where my question was coming from is, are you seeing families go, okay, we've done this and it was okay. So
yeah,
we're ready for the younger group, or is there hesitation because they're so small?
Yeah, I've definitely seen that where, okay, my older kids got it. Everything was fine. I'm cool with my younger kid getting it. And then I've also seen the opposite where they don't have the older kids. And this will be their first kid that they're vaccinating, because they've only got littles. And there's a little bit of, I think, fear and hesitancy there. And there are still just a huge number of parents that just don't think COVID can affect kids, which I'm still this far in just a little shocked to see, to be very honest.
I wanted to ask you too. I mean, now that you're seeing it mutate and we're seeing different variations, how is it affecting the youngest age groups?
So with Omicron, what we're seeing is it really affects the upper airway of the kids. And this is why, in fact, Omicron has caused so much problem with kids. And we've seen that higher hospitalization rate because kids have tiny airways, right? They're not big like us. And so they're having trouble moving air past that swollen airway. So they need breathing treatments and oxygen supplement and that sort of stuff. They do fine in the sense that, yes, they're being discharged. They're not dying. Omicron doesn't seem to kill kids the way prior variants did, which is fantastic. But one, we don't know what the next variant might bring. And two, I don't want my kid admitted to the hospital. I mean, I work in a hospital. I don't want I love my hospital. Hospitals are wonderful places. I don't want my kid in a hospital. And the vaccines, again and again and again, one of the things that I want to emphasize is, these vaccines are not perfect. Would I prefer them to be more effective? Absolutely. But again and again and again and again, we show in study after study after study that vaccinated kids, vaccinated adults are less likely to end up in the ICU. They're less likely to have complications of COVID. So it just makes sense. Until better vaccines come along, I want my kid as protected as I can get them.
And that's why I want to pick your brain, because you have gone through all the research and been part of the groups studying all of this and seeing it firsthand. So how is this vaccine doing in terms of protecting kids? What are you seeing?
What we see, so there's a couple of layers to the protection that the vaccine offers to kids. One is it's very clear that kids who are vaccinated are less likely to be hospitalized. Because the disease just doesn't seem to be as severe in them. And I will say it still prevents disease. I hear people again and again say, oh, you can still get disease if you have COVID. And that's true. You can still get disease if you're vaccinated, but it does prevent some, not as much as we'd like. I mean, we'd love to go back to the pre-Delta days when vaccine efficacy was 95%. Those days are gone. Maybe one day they'll come back. So there is a layer of protection, probably about somewhere between probably in the 35% range. So first you've got that reduction in risk that your kid might get exposed. And if they're in that 35%, they won't even get the infection, or they won't even get disease, which is fantastic. They're less likely to be hospitalized. The reduction in mortality is like 5% or fivefold. So it's a fivefold reduction in mortality risk. The other key thing is that what we noticed, and we noticed this right away as soon as kids under the age of 18 started to get vaccinated, was a dramatic protection against MIS-C. So many of you will remember that there's this inflammatory condition that kids can get, and it is primarily kids, more than adults. About 4 to 6 weeks after you get COVID, even mild or asymptomatic COVID, kids are at risk for something called multi-system inflammatory syndrome in children associated with COVID-19. It's rare. We're not 100% sure, but it's probably a little bit less than 1% of kids who get COVID will get MIS-C. But that's not zero. And MIS-C lands kids in the ICU. The vast, like 80 or 85% of kids who get MIS-C require ICU level care. They're often in the hospital for weeks. It's a horrendous, I hate MIS-C. It literally makes my stomach clench to think about treating children with MIS-C because it's a horrifying disease. And there's two different reports that have been published looking at it, and kids who have been vaccinated have somewhere between like a 93 and 97% reduction in their risk for MIS-C if they're vaccinated. That's massive. That's huge when you think about, how bad MIS-C can be. So yeah, and then the last piece is long haul. So the studies have only been done in adults, but it does appear that if you get COVID after you've been vaccinated, your risk for getting long haul is reduced by about 50%. It's not 100%. You can still get long haul after COVID, after being vaccinated, but that risk reduction is there. And kids can get long haul. About 7 to 10% of kids who get COVID, and this includes very young kids. We have kids down to the age of 4 in our COVID recovery clinic. So there's about 7 to 10% risk of getting long haul for kids after getting COVID. And this vaccine appears to cut that risk at least in half, if not better. And so as a pediatrician and as a parent, it just I'm all about the risk reduction. We know as parents, we can't ever make our kids risk zero, right? We can't protect our kids from everything, but why would I not protect them from this? It just makes so much sense to me.
I do want to ask, because I had a friend when they were first talking about getting vaccines, they were testing vaccines for kids. It wasn't out yet. And her son at one point had something that led to MIS-C. And then she was saying, well, I can't get the vaccine because the vaccine might kick in MIS-C for him. I don't know where she got that information. I don't know where she was going, but that was her hesitancy, was that her son had issues before and she was afraid that the vaccine would kick it in. Is that
yeah? Actually, we were all worried about that back in the day. We were watching those pediatric trials exceedingly carefully because I myself was really worried that the vaccine would trigger a MIS-C-like response. Thankfully, it did not. And so within our own MIS-C group at Rainbow, we started, kind of with the mildest kids and the kids who had MIS-C the longest ago, getting them vaccinated. And then we've been moving through the population, even now to kids who had, myocarditis as part of their MIS-C. And we all know that the vaccine can cause a very mild myocarditis in a very small percent of patients. And the kids tolerate it fine. Like it doesn't trigger a relapse of the MIS-C. It doesn't seem to affect the kids really at all. And what I kind of have said to my MIS-C parents is, I hear you, I do. And I had the same concerns. I think those concerns are unfounded as far as I can tell from the published data and from my own clinical experience. But then the other question that we can't answer is what happens when these kids who've had MIS-C get COVID again. Now, I can say that I know of at least 2 of my MIS-C kids who have gotten COVID again and they did okay. but that was with the Omicron variant, which appears to cause less MIS-C anyways. So I'm like, for me, the protection from the vaccine is, given that we know how safe it is, especially for our MIS-C kids, is preferable to running the risk that they could get MIS-C again if they got reinfected. And so, yeah, that's definitely something we had to address ourselves, because we were very worried about our MIS-C population as well.
I want to talk to you also about timing of this, because by now, especially with the Omicron variant, and of course we're seeing a spike here in the summer, and now all of a sudden, okay, your youngest 5 and under can get vaccinated. What for families and parents and kids who maybe the kid, the toddler just had been exposed in a family that just had it run through the house, or maybe they had it in the spring, or the child themselves was had tested positive for COVID, but now they're able to go get that vaccine. Do they go and get it? Is there a natural protection that, if they've been diagnosed with COVID, do they have that for a few months? What is the timing on going and getting this vaccine?
That's a really great question, because Omicron, of all of the variants that we've dealt with thus far, infection with Omicron appears to give the least amount of natural protection. And so I mean, as much as the vaccine isn't as effective as we'd like it to be, Omicron's worse. Like, there's really no protection for getting a repeat infection if you've had Omicron. And so we basically say that if you're out of quarantine, then, and you're kind of back to your baseline, then it's fine, go get vaccinated. And in fact, that combination of natural infection and vaccination does appear to be more effective than either singly. Now, my preference is get the vaccine first and get the natural infection second, because of all the protection that the vaccine offers. But for those who missed, the opportunity because their kid got sick before the vaccine was available, again, that combination does appear to be more effective than either by themselves. And as I've said already here today, we don't know what the next variants are going to bring. And so we want to optimize protection to minimize risk.
I had my older ones vaccinated. My youngest, she has her toddler wellness check any day now, so we're gonna go forward with that. But my older two did have a reaction, and their reactions were so different when they did get the vaccine. One actually kind of got nauseous, the other one just sort of a little bit fevery, didn't feel well, slept a little bit. What kind of symptoms should we expect? When should have you seen any that should be concerning? Like, when do I call my pediatrician and say, hey, you know what, she's really sick, or he's having this strange reaction, or I'm seeing something's odd? Have you seen any of that? Is there a point where parents should be monitoring more closely or calling the doctor?
I mean, that's a really great question. We haven't seen anything like that. But with any vaccine, anytime you stimulate the immune system, there's always, that concern. Could the fever go so high that the kid gets dehydrated, or, something like that? That's true for any time. I mean, it doesn't matter whether you're stimulating the immune system with a vaccine or with a natural infection, there's always the chance that the cytokine response can get out of control. So sure, yeah, those high fevers that you just can't get under control, dehydration, things like that. We haven't seen it, but yeah, sure, it's theoretically possible, I suppose. What the study showed and what we're kind of seeing is the kids from 1 to 4 seem to tolerate the vaccine ridiculously well. Like they just, I mean, how kids are, it's like, whatever. The kids under 1 do seem to have that, from 6 months to 1, do seem to have a slightly higher rate of fever than those older kids. So I would encourage parents, Tylenol or ibuprofen as needed to keep the kid comfortable. And it seems to resolve within like 12 to 24 hours. I think there was like one kid who it lasted like 48 hours or something like that. So it's pretty mild, and really it's very much in line with what we see with other vaccines, the DTaP and the pneumococcus vaccine and things like that we give to kids. So there's not been any reaction that's outside of the range of what we see for other vaccines.
And then with vaccine hesitancy, I feel like a lot of parents, if they've said, oh, I'm just going to wait, they keep saying, because this is a new vaccine, it's new. I'm going to wait. I'm going to see how it goes. Is this still considered a new vaccine? And when is a vaccine or a medication not considered new anymore?
I don't know. I guess that probably depends on the parent, right? And their perception of new. I mean, to me, it's not really a new vaccine anymore. It's been around forever. I think also, I think the perception for me as a medical doctor is maybe a little bit different than a parent. And you said something you said, when is a vaccine or medication not considered new? The thing to remember is vaccines aren't medication. Vaccines aren't something that you put in your body every single day to keep a certain drug level, up, the way you would do with reflux medicine, or the way you would do with seizure medicine, or the way you would do with blood pressure medicine, or whatever. A vaccine is something you put in your body a certain number of times, once, twice. Yeah, I think what the Tdap is, or DTaP is, 4 times or 5 times or whatever it is, and then you stop, right? I mean, it's not like every day you're putting this stuff in your body, and so you're worried about, like, over time, could some sort of toxic reaction develop because of that ongoing exposure. And that's what happens with medication, right? When you talk about new medications, you do worry about the long-term side effects of that medication, because you're putting it in your body every day, and studies can't study that. I mean, just by their very nature, they can't study that. But with a vaccine, we don't really talk about long-term side effects, because that's not a thing. You're not putting the vaccine in your body every day. And so I think parents, or people in general, have this thought that, like, 10 years from now, suddenly some reaction is going to happen that had been triggered by the vaccine 10 years ago, but it's only manifesting clinically now. And there's not really a biological mechanism for that to happen. So, for instance, I've gotten 3 doses. I'm under 50, so I didn't require a second booster. There's nothing in my body. There's no Pfizer mRNA anywhere in my body. There's no spike proteins anywhere in my body. I have the residual antibodies, but that's just, I mean, that happens every time we get a cold, every time we get exposed to anything, your body carries residual antibodies. That's a normal thing. So I'm not sure, like, 10 years from now, since there's nothing in my body, like, how is my body supposed to suddenly come up with some sort of problem from that vaccine 10 years ago, So I understand why parents think it, or I understand why people think it. And it's because you said drugs and vaccine, people put those 2 things together, but they're actually different things. And so I think it's a somewhat common misunderstanding that, for instance, I hear people say, oh, but the hepatitis B vaccine's been around forever. We know what its long-term effects are. There are no long-term effects. Vaccines don't have long-term effects. It's not a thing. If a vaccine is going to have an effect on a body, it's going to happen within the first 6 to 8 weeks of it being put into your body, because after that, it doesn't exist in your body anymore. And so it has to start then. Like, if you're going to get Guillain-Barré from the vaccine, you have to get it then. If you're going to, if it's going to do something to your body, it has to start doing it then, as opposed to, 10 years from now. So there are no long-term studies on hepatitis B vaccine. There are no long-term studies on the hepatitis A vaccine. Those don't exist because we don't do that, because there's no biologically logical reason to do a long-term study on a vaccine. That's not a thing. And so I think people keep saying, oh, I'm waiting for the long-term studies. Well, they're going to wait for the rest of their lives, because there's not going to be a long-term study.
Yeah, I've heard you say that before, but I think putting it up against the medication analogy, it just makes it so crystal clear. So thank you. And then I guess my final question in all of this too is, I feel like you can't throw a rock right now without hitting somebody who just had COVID or has it or whatever. We were seeing the summer spike, and we keep talking about, well, the fall, once kids go back to school, we're going to see another spike. Do you think that we will see this summer spike and then again in the fall? Is that how it's shaping up with these variants?
It's very possible, because there's a new subvariant of Omicron that's burning through Israel right now. Keeping in mind, they just went through an Omicron wave themselves, and they're going through another one. And yeah, like I said, natural infection from Omicron doesn't seem to confer much protection. Now, what we would love is, if we could get to a point where getting these infections didn't cause long-term complications. I mean, it's one thing to talk about dying, right? I mean, that's horrid and we want that to stop. Omicron is a step in the right direction because it is less deadly than prior variants, even though it is more contagious, but it still causes long haul. It still causes, other problems. So what we would love to move towards is this world in which we can get infected with COVID, maybe even get infected with it over and over again, and it doesn't do anything to us other than make us sick for a couple of days. And I think a lot of people think that we're already there. Oh, it's Omicron, I can just get COVID as many times, it doesn't matter. It's like getting a cold now. And for some people that may be true, but for those who turn out to be long haulers or who turn out to have organ damage like that, it can damage your pancreas, it can damage your kidneys, it can damage your heart. It's not true. And so I think, yes, I think many of us do expect another wave. And yes, it is somewhat inevitable in the sense that I don't think there's a lot we can do to stop it, but we can protect ourselves physically. It's extremely clear from the medical literature that if you are protected by the vaccine before you get infected, you're less likely to have complications. It's not as clear that prior infection gives you as much protection against those complications. And in fact, I can tell you, I have multiple kids in my COVID recovery clinic who didn't get long haul until their second infection. And so, I mean, it worries me a little bit, that we have chunks of the population that are just allowing COVID to move through them again and again and again. And I worry about their long-term health. Yeah. I really do.
What are the most common long haul symptoms, or is it as wide and varying as what adults are experiencing?
It is wide and varying. There's probably 30 some odd symptoms that kids can get. But the most common symptom, far and away, 80%, 90% of the kids who come to the COVID recovery clinic are coming with profound and overwhelming fatigue, just an inability to do daily life. For some, it's a little bit more mild. They can make it to school, but they've had to cut out their after-school activities. They just need a nap in the afternoon, which, I mean, what 14-year-old is going to voluntarily take a nap instead of hanging out with their friends or going to football practice? But for some, it's crushing fatigue. They can barely get out of bed. They can't go to school. They can't do anything. They can't see their friends. I mean, they do nothing but sleep. I've got kids coming to clinic who basically they sleep for 18 to 20 hours a day. They can barely eat because they're super nauseous. Loss of appetite is really common. Nausea is pretty common. Headaches, stomach aches. We see kids with, there's this condition called post-exertional malaise. So you're tired, but you try to like push through and do something. Let's say I'm going to go out and hang out with my friends because I'm so bored and depressed from being, so tired all the time, or I'm going to try to go to school this morning and do like 2 classes. And then they crash. And then they'll often sleep for like 36 hours afterwards or something like that. I mean, just this, massive crash. We see that body pain, like non-specific, like kind of like a fibromyalgia type non-specific body pain, which is really hard to watch, like a, 12 or 13-year-old be in pain all the time. I mean, you name it, depression, anxiety, it's COVID long hauls is like the worst thing ever. I hate, I mean, I love doing it because I want to help these kids, but I hate doing it because it's really hard to watch these kids and these families go through this.
And just to reiterate before we go, you have seen the vaccine prevent against long haul symptoms?
Oh yeah. Well, I mean, we can't see it. Like you never know what's going to happen to an individual person, right? It's not like I can have a 2 versions of the same human and I vaccinate one and I don't vaccinate the other. But what we do is we compare vaccinated with unvaccinated populations at the end of a wave. So you have a wave of COVID go through, you see who all is diagnosed with long haul, and you see, okay, what % were vaccinated, what % were unvaccinated. And we see far and away the vast majority of long haulers are unvaccinated, indicating that the vaccine appears to protect against long haul. It's not 100%, I think I've got like one kid in my COVID recovery clinic who was vaccinated and then still got long haul. So that, it's not 100% protection, but it does definitely reduce the risk for long haul.
I want to thank Dr. Amy Edwards for her perspective, and hopefully this helped as you're faced with those decisions. Thank you again for joining me on the Mom Squad podcast and also all of our streaming channels. I'm Maureen Kyle. I'll see you back here next time.
Thanks for listening to Mom Squad Pod with Maureen Kyle from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.